My name is Perez, and I'm a second-year doctoral student in the School of Nursing here at the University of Pennsylvania. I'm also a Robert Wood Johnson Future of Nursing Scholar at Independence Blue Cross Foundation. I did my undergraduate degree at St. Mary's College in California, and I was actually a health science major there. So I didn't start out with a nursing trajectory in mind. I actually was thinking about becoming a forensic scientist, and after that, after I graduated, I worked in a lab and decided that I really liked working with people, and so decided to become a second-degree nursing student and went back to school. After that, I went to go get my master's at the University of California, became an adult nurse practitioner, focusing in infectious disease. During school, I worked in residential care facility for people living with HIV and AIDS as a nurse case manager, and really loved it. That's where I really became passionate about working with people living with HIV. And during that time, I also started to see a lot of systems issues, policy issues, funding issues, all of these things that were impacting the way that I delivered my care, all of these things that were impacting the patients that I was trying to work with. And so when I graduated, instead of going to work as a nurse practitioner right away, I decided to apply for a little bit more training around policy. And so that led me to a public policy fellowship in Washington, D.C. with the Congressional Hispanic Caucus Institute, where I continued to work on HIV, AIDS issues, but at a much sort of larger level, on a bigger scale. I think being a Latino, being a male in this profession has really shaped the way that I look at healthcare, how healthcare is delivered, and really shaped the way that I look at disparities in healthcare. And there are very significant disparities, not just in the Latino community, but in the LGBTQ community. Certainly among women's healthcare, there's a large disparity in this country. And one of the things that Penn focuses on, particularly in their School of Nursing, is working to alleviate some of those healthcare disparities. And I think that I see that woven in, I've seen that woven in not only through many people's research trajectories here at the school, but in every course that I take, we talk about healthcare disparities, policy implications, and how we can use what we're doing to alleviate some of those disparities.